What an honor it is to share this stage with Professor Yunus. He was my mentor and teacher nearly 2 decades ago. He made me live in the villages I was studying to understand the true meaning of sustainable development. My name is Alain Labrique. I'm currently serving as the director of the Johns Hopkins University Global mHealth Initiative. I've been asked to talk to you for 6 minutes. In these 6 minutes, 6 women will have died from mostly preventable causes, either in or contributed by childbirth. Somewhere in the world, probably in one of these countries. I had the privilege to be born in Bangladesh just after a terrible war of independence, the son of a Belgian diplomat and an Indian school teacher. My mother delivered me in what was a converted hallway of a barely functional health facility. We both nearly became statistics. I, through obstructed labor, probably because of my big head, and she from postpartum sepsis. There were no stable communications, land phones did not work, and my father on bicycle rode from clinic to scrounge together enough antibiotics to save her life. In Bangladesh today, despite major improvements in maternal mortality, the rate is roughly equivalent to 1 Boeing 747 filled with pregnant women and new mothers crashing every 2 weeks. The tragedy is the same in India, its neighbor. Why isn't this a major headline alongside news of a global economic crisis? In these 6 minutes, 126 children under the age of 5 will have died across the globe, 21 each minute, many from preventable causes. Simply because in the first 4 weeks of life, and in that narrow window of the first 2 days of life, when the risk of mortality is the greatest, we could not get simple, proven solutions to them in time. True, we have made substantial progress in the past decades towards the UN MDGs, but we need strategies and innovations to get us there faster. This is why I am here today to share with you a solution that we call mHealth. One of the most transformative innovations that we've heard about time and time again today is this, the mobile phone. In less than a decade, the rate of growth, reach, and increased affordability of this technology has stunned even the most ambitious forecasters. By the end of 2010, over 90% of the world's population lived within reach of a mobile phone network. In 2011, over 3/4 of the world's 5.9 billion mobile phone subscriptions in the world were in the developing world. In the past 5 years, new fields of innovation have emerged, prefaced by an M for mobile, M banking, M agriculture, M learning, and M health. A global M health alliance, academic initiatives such as ours at Johns Hopkins, and new public-private partnerships have been formed to support and fuel this ecosystem. Over the past 10 years, hundreds of pilot projects across the globe have tested mHealth strategies to increase the capacity of community health workers to improve the quality of care they received by the populations they serve. We are able, using mHealth, to ensure pregnant women receive antenatal care, register births, and ensure high rates of timely vaccination. Frontline health workers can be notified of births, even can be notified of labor, as we have done in Bangladesh, to ensure skilled care during delivery and to provide the basic strategies we know can be used to save lives during that precious window of time when the risk is the greatest. mHealth systems are being used to reduce the risk of buying counterfeit drugs, as mPedigree is doing in Ghana, and that other projects such as SMS for Life ensuring that supplies of essential drugs to treat malaria are available in clinics across Tanzania. mHealth systems help us track the growth of children in Malawi, alerting us to when a child is not growing as they should or recovering from an illness. mHealth systems have been shown to improve adherence to drugs for HIV and TB, often very complex regimens that require to be followed optimally for best outcomes. Frontline health workers are the first point of care for most of the bottom billion of the world's poor. often disconnected from the health systems which they should be a part of. We and others are using mHealth to connect them and to support them when they need access to guidance. USAID and partners have deployed the MAMA project in South Africa and Bangladesh to send subscribing pregnant women messages about managing a healthy pregnancy and taking care of a newborn. New tools, such as this one, can allow community health workers to educate their communities in new and innovative ways. Other technologies, such as this O-scan device, a simple attachment that sticks to a mobile phone, turning it into an imaging device to identify suspicious oral lesions. This increases the capability of community health workers to now include cancer identification. We can imagine in the not too distant future a mobile phone being part of the core set of tools provided to every new community health worker, or a health phone connected to essential downstream services and health information given to pregnant women as part of their routine antenatal care, as simply as one would provide an iron folic acid supplement. These simple yet radical changes are achievable within the next 5 years and will be as revolutionary to global health as was the introduction of vaccines. Working with governments, the private sector, and other stakeholders, the goal of mHealth is to strengthen health systems, allowing us to meet our promises of universal health to families. I'd like to conclude by asking us to think about the premise of this day. Our effort today is to make these conversations about sustainability, about development, global. We can aspire to this only because we're now able to connect people from villages in rural Zambia to cities in India to this conference room right here in Brazil. We have witnessed this year how normal people with extraordinary vision have changed the trajectory of their nations. I ask you to join us in making another vision a reality. mHealth has given us the ability to make sure that every woman, family, and every child is counted, and that every newborn is given its best chance at survival. The bottom billion of this world now know that they are connected. And these solutions that we discuss in Rio must be put into practice. If in 10 years, mobile health systems have not been used to take us that last mile, it will not have been because we were technologically incapable of doing so. It will have been because we made a choice not to. Thank you very much.